And we're here at a significant time in the history of our community that brings us together to talk about the rise of COVID-19, both in the community and in our hospitals, and how it is affecting the very infrastructure of what we use to take care of the community. All three of us are dedicated to the health of our communities. And at this time, we see that our health systems are being threatened because of the rising volume of COVID-19. Our ability to care for our communities are being threatened. We are seeing ever increasing numbers of patients, both in our EDs and in our hospitals, and we're seeing increasing numbers of our employees becoming ill. In addition to that, other crucial infrastructure is being affected in our communities. Like all of you this morning, I watched the news and saw that our high school students are being asked to take public transportation to school because the number of bus drivers is inadequate to use regular school bus transportation because too many of the bus drivers are ill with COVID. We know that our EMS and other safety structures are being threatened because too many of our firefighters, EMS drivers, and even police officers are ill with COVID. And so we come to you this morning and say, we need your help. And there are some simple things you can do to be of service to us. You can wear a mask when you're out in public. You can avoid large crowds. If you've not yet had your booster shot, you can get a booster. We would ask if you've not yet been vaccinated that you reconsider and get vaccinated. We know that people are tired of these restrictions and they want to go back to normal. Well, let me tell you, so do our caregivers. They're ready for this pandemic to be over too. And these are the things you can do to make that happen sooner. So we would ask, help us help you. We want to be there when you need us. We are not political people. We want people to know that it is all of your health systems. It's all of the hospitals in your area, and it's more than the hospitals. It is the entire safety net structure in your community being affected. And it is going to require all of us working together so that we can keep you safe. We're healthcare professionals, and our entire life has been about serving others and keeping our community members healthy and safe. And we are telling you that we're at a point that we need the public to hear us and help us so that we can continue our mission, a mission that we take very seriously. Modeling does show that this should continue most of January and should get better in February if we follow the modeling of what Omicron has done in South Africa and Europe. So we're hopeful that it'll get better in January. And so that's at the end of January into February. If people would help us and do this, it certainly will be better by February.